tonight, just a couple of announcements. We've got a starlight cruise going ahead on Saturday night, so we're going to sail out into the wild blue yonder and look at the stars. There's an astronomer coming down to tell us what to look for. So if you want to do that, there's a briefing at 3 o'clock in the afternoon on Saturday, and please register online. And I'll just mention the Progressive Dinner is on the 22nd of April now, and there should be rego for that available. I think it's already available actually. Anyway, on to tonight, we've got a talk on medicine at sea with Dr. Helga Weaving, who is a consultant at emergency medicine, if you understand, also a very experienced sailor. I think many of you already know her. She has 40 years sailing experience, and she's sailing on Endorphin to the Exmouth, and she's one of the official doctors on the Exmouth race. So she certainly knows what she's talking about. The format tonight will be about a 40-minute-ish presentation. Then have a break for about 15 minutes to grab a drink, and then there'll be a practical demo. So take it away.
Thank you very much, and thanks for coming. So I have a quiet voice, so if I move away from the mic and you can't hear me, just do a wave from the back. So I want to talk a little bit about medicine at sea, and this is a bit of a combination talk because some of this is for cruising, and some of this is for racing, and some of this is a little bit of the Fremantle to Exmouth race for those doing that race as well. So it's a little bit across the combination. Feel free to put your hands up and ask any questions at any time. Do I need to move further away from the mic? Is that better?
No, it's good.
It's okay, good where I was? Okay. So a bit of a combination. Otherwise we'll go through, and obviously I'll be around, we'll have a nice break, you can stretch your legs, and we'll do a practical session, and I'll be around afterwards if you've got any specific queries about what's going to suit your boat or what sort of sailing you're doing. So really we're talking a little bit about sometimes, particularly when you're going offshore, or if you're going cruising, you're going away for a long time, you actually want a medical kit. And what's the difference between a medical kit and a first aid kit?
Size.
Drugs. Yes, it's got drugs in it. the prescribed drugs, not the illicit drugs. They've got drugs in it. Okay. So, what are you going to take? Really depends on what you're doing, who you're doing it with, how long you're going, and what size cruise. So, there are lots of guides around, and then you increase it up, and obviously, depending on who you've got in the crew, you might change what you're taking and increase up and down. So there's a good starting point is the old-fashioned blue book for people doing offshore racing, which now you've got the special regulations. And even if you're cruising, that's actually quite a good starting point because you're going to use a lot of the same type of kit. Medicines, people don't change. The conditions of what you're doing haven't changed that much. So it's this small document here. But the medical stuff is only this much. So it's not, and that's actually quite a good, it's all online. You just go to Australian Sailing and have a look, and it's all online. It's a really good starting point. What should I have when I'm going for a bit longer, a bit further away, need some more stuff, or we're going racing? And if you are racing, obviously this is what you have to take for depending on your category of race, this tells you what you have to take. And the only thing is, for those who are doing the Fremantle to Exmouth, obviously Cat 2, but the morphine is optional. So it's one of the things that if you want to take it, you can, but you don't have to take it. And I think that's now the same for the Hobart. It used to be you had to have morphine for Hobart, but I think it's now moved to optional. Got to think also who you're sailing with and what they've got and what major health problems. And I can tell you this from having been a race doctor for many offshore races. Generally, people are meant to tell you what problems they've got, what major health problems they get, and you get a list of them as the race doctor. And I remember being race doctor for the Geraldton race, and I got one person with one problem, and they were the person on my boat, and I already knew about them. And I thought, you lying toes, because there's a whole lot of you out there, half of you are a certain age and most of you have got problems. The things that you really want to know often is, and you don't care about the minor things, but people should know if you're sailing with a group of people, you really want to know about the serious stuff, and also you want to know if people, often for injuries, things like people being on anticoagulants is very important. Because if you hit your head seriously, I'm not talking you open the kitchen cupboard and cut it, but if you hit your head seriously on an anticoagulant, you have to get a CT head. So it does change a little bit what you're doing and when you're thinking of doing it as well. So it depends what you're up to. And some of this is directed more for racing, but the same principles apply. It doesn't change just because you're cruising. You know, you need to, whoever is your medic, whether it's the skipper, whether it's not the skipper, whether it's somebody who's got more professional qualifications or not, depending on the skippers on the boat, should know where your kit is and what is in it. And often the best way is, I mean, for endorphin, racing endorphin, all of our stuff's in plastic, sort of Sistema Tupperware type things, with a list, a list on the top of what's in there, and so you can see through it, so you don't have to keep opening everything to see what's in it. And so I've got the, bandages and things in one box, and I've got the medicines in another box, and so I've got other stuff, cardiac stuff in another box, and it all sits in the same cupboard, but so it's easy to pick up. And also you don't have to take it all. If someone's just got a wound, you can just take that out of the cupboard rather than opening up everything and then throwing it all over your head, because what you want is at the bottom of a big kit. Also, if you are, in this particular, if you are going off, it's always worth checking people who brought their medicines. I had to come back, we were doing an 18-day cruise in New Zealand, and we had to go back after the first day because somebody forgot their medicines, left them at home. So we all trotted back, got the medicines, then we trotted back out. Really, for your first aid cuts, all your bandages, plasters and things, it's worth thinking a little bit about it because there's a lot of stuff that doesn't stick very well to wet skin. So you've got to think for your plasters, more the fabric type or just ones that are going to stick. There's no point having something that lifts off as soon as it gets wet, particularly if you're going offshore. Fixmol's really good. I mean, a lot of people here may have used Fixmol or seen it. It comes in a big roll of like a wide white tape. It's really good for covering wounds, sticking things together, and it stays on even when it's wet, so it's really, really good. And you can wash, so if you had something on your fingers, you could wash your hands with it. It sticks really well, it's excellent. It won't stick if you've got like a sunscreen or if you've got some oil there, but it will stick otherwise. If it's just pure wet skin, it sticks very well. Think about what you're getting as well. It's because a lot of times you have stuff in your first aid kit, your medical kit. You're hoping to buy it and never use it, generally. And so it can sit there for a long time, and if you're getting a big kit, it's quite expensive. Now if you go to your pharmacist normally and you have a chat about, you get a script from your doctor for an antibiotic, you're going to take it pretty much straight away. Whereas this stuff might sit there for 2 years, so it's worth saying to your pharmacist, if it's going to a first aid kit, medical kit may never get used, you want a long expiry date, because that's much more important, because it means you don't have to renew your kit every 2 or 3 months. And also worth controversial statement that perhaps you need to throw the beer out of the fridge and put your first aid kit in. Yeah, I know. You will, like if you keep stuff, particularly if you're storing it in a yacht here, and summer temperatures can go up to 50 degrees, so you will find that a lot of stuff will degrade a lot more quickly, because it's designed to be stored at 20, 25 degrees. So it's worth, if you've got an offshore kit, or if you've got a racing kit, or if you're going cruising, and if you're not on the boat for a long time, take it off or put it somewhere it's a reasonable sort of temperature to be stored. And I always get asked, so I'll say it now, can we use expired medicine kit, splints, whatever, and so forth? I say, look, as a doctor, I would always say that I can't professionally give somebody something that's expired. If it was me, I would take it. If that gives you your answer. It's when they set expiry dates, particularly for medicines, they have to guarantee that it's in a good condition for so many years. So when they do that, they have to check it every so often. So after a while, you can see the company has very little incentive to make sure that it's still okay. It's probably fine. It doesn't, your paracetamol tablet does not spontaneously combust just because it's out of its expiry date. But be sensible, if it's 20 years out of its expiry date, it's probably no good to you. And for injectables, that's a little bit different because they're a little bit more sensitive in terms of the storage. Very self-explanatory. And generally, if you're giving a prescription medicine, you should be just talking to a doctor, and that might be through a system if you're cruising, or if you're racing, then you've got a race doctor you can speak to. This is for all the way you can give your medicines, and this is more so because for a lot of the offshore races, they'll have iron medication that you give as well. So that's why that's up as how you give things. The reason this is up is because sometimes people give a tablet and they go, well, it hasn't worked. And I said, well, how long has it been? Oh, 10 minutes. Well, of course it's not worked. If you take a tablet and then they give another one, and then the patient looks a bit sleepy and a bit drowsy because you've given them too much. So you've got to work out that if you're giving somebody, say if they've broken their arm and you're giving them some oxycodone, you can't just say, oh, look, it hasn't worked in 5 minutes, let's give them some more. It's got to be half an hour, 40 minutes before you can be sure that it's really worked. And that's also why I say to people, if you've got an injury, because other people go, oh, I'm all fine, if you've got injury that looks really sore, I say, well, it's going to start hurting soon, and if you take a tablet, it's going to be 40 minutes till it kicks in. I recommend you take it now, because then at least it starts to work as the adrenaline wears off, and it starts to be sore. This is here because in the offshore kit, you can have some rectal oxycodone. I don't know why, because, rectal stuff is designed to melt at body temperature, and most racing yachts get over body temperature in summer. But it is there, so that's why I put it up. Personally, I don't know why they've got it, but if you have anything, it has to be stored in the fridge, otherwise it would just be a gooey, melted mess. Some boats will race with doctors, nurses, or people with other sort of healthcare experience, in which case they may have things to give things intravenously or intramuscularly, and be very happy to do so. So obviously, you're going to pick what's going to suit your boat and what experience you've got on the boat. Make sure I keep to time. There's an old adage, when in doubt, read the manual. Now, none of us are very good at that, but most of the stuff, the reason we give a lot of this talk is generally if you get given a prescribed medication, somebody's explained it to you, whether it's the pharmacist or your doctor, somebody's explained the medication to you. But most of them come also with leaflets, which you can read. It's also really good, and I think this goes the same for any boat, whether you're cruising, whether you're racing, having a little day kit that is separate to your main kit, because your main kit, you really want people to either the skipper or the medic to be going into, so that you don't go into and think, where is everything and how come half it's missing? And so a little day kit that you can just have separately, and I don't need to know if you've got a headache and want to take a paracetamol, you can go do it yourself. It's all, you've got simple things, you've got some paracetamol, some ibuprofen, a few plasters, an antacid for when they get gastritis from too much booze. That simple sort of stuff that just sort of sits there. They can access it. Nobody else needs to know. They can take whatever they want. So this is the reason this is all quite formatted. This is because this is what's in for the Exmouth race, and this is for the offshore racing, and this is what you need to have as a minimum. Now, this is only a minimum, and if you're going for longer or if you've got more people, you should get more. But just to give you an idea that it's about 5 days for one person for the paracetamol, and similar for ibuprofen, so it just gives you an idea of what that's going to give you per person. So if you're going cruising for a lot longer with a lot more people, you probably need a bit more. And then in the rest of the kit, you've got your sort of paracetamol codeine mixes, which is your Pandine Fort or Codopain Fort. And this gives you about 2.5 days supply for one person, just that packet of, and basically it's designed if somebody has a serious injury, if they sprained something, hurt themselves, put their back out, broken something. So it's designed more for this more serious levels of injuries. But certainly if you're off cruising as well, you could also talk to your doctor about having a script for some to have on the boat, because it could be a first line, maybe a while for you to come back to shore. And this is the severe pain. So these are really designed for people who've seriously injured themselves. You've got your oxycodone, you've got the which are the oral tablets, and then you've got your suppositories. And then you've also got the IV or IM morphine as well, which is optional for the race, but you can still get it depending on what you decide. Anyone who's had morphine, oxycodone, any medicine has a side effect. Some of them are mild than others. So just so you know, for the opiates, a lot of it's nausea and vomiting. So we often say to people take an anti-sickness medication as well. So what I often say to people, you've had somebody who's really had a nasty break, nasty fracture, or they've hurt themselves a lot, you can always, it's hard to say, pain doesn't usually kill you. You can give more, but you can't take it away, is how I say. So you can start gently, you can start giving people things, you can always give them more if they're still sore and it hasn't worked. And that's absolutely fine. So for your oxycodone, 5 milligrams to 10 milligrams is quite a reasonable dose for a normal person. If they were on the smaller side, you'd say 5. Big strapping bloke, you'd probably say 10, just as an idea of what's going to be reasonable for someone to take for a serious injury. These are the suppositories. The morphine is in there, and generally it's going to depend. People are usually only getting morphine out if they've got a very serious fracture or multiple fractures or injuries. And often for big blokes, I think when we had one of the nasty injuries in the Geraldton races, they gave 10 milligrams intramuscularly for a person who'd sort of gone one side to the other side, broken lots of ribs and had some internal injuries. Now, the only reason you can have the opiates if you're doing the offshore sailing on the boat is because you have naloxone as well. And naloxone is an opiate antagonist, so it's the reversal agent. So if you accidentally, if somebody is saying they've got, excruciating severe pain, you accidentally give them too much, and they get a bit sleepy, and then they look a bit blue, and then you're a bit worried. If you give this, it will reverse then they'll be in pain, but they won't be dying. That's always an important fact. All your cardiac stuff is aspirin, very sort of underappreciated medicines, your aspirin and your GTN. And usually if people do have cardiac issues, they probably should be taking their own stuff on the boat. But generally in the offshore kit as well, they have a GTN, either tablets or spray. The tablets are quite good because the side effect of GTN is it's a smooth muscle dilator, so it drops your blood pressure. And then people start to feel a bit faint because their blood pressure dropped, they can just spit the tablet out. The tablets are going to the tongue, so that's often a bit easier because once you give them the spray, you can't take it back. So these are getting onto the sort of less life-threatening but other things that you can think about. And these, fortunately, a lot of these are much more common. So issues with your eyes. So chloramphenicol ointment, I don't know if many of you have got perhaps the chloramphenicol drops from the chemist. So those are the eye drops you can use for like pink eye, and you can just buy them over the counter. So this is the same thing, but it's in an ointment preparation. And it's good for if people have a corneal abrasion, which is like a graze on the front of the eye. So if a corner of the rope flicks in your eye, it scrapes the front of the eye, and it's really irritated because it's scraped and it's irritated. This is what we use for it. We use the chloramphenicol ointment. And it's also really good for things like little coral cuts and nicks that get infected because it's quite a nice, it gets into sort of corners of your fingers, and you can just use that for nicks and things. It's actually it's a very good preparation for that as well. So for your offshore kit, basically you've got a course of each antibiotic. So the ciprofloxacin is only used for the Cat 1 races. It's a very good broad-spectrum antibiotic. Cefalexin is used, which is in the Cat 2 for those doing the Exmouth race. You've got cefalexin. Now, the reason they haven't put augmentin there, augmentin is probably actually a more useful antibiotic, but they took it out because they're worried about penicillin allergies. Now, if nobody in a boat is allergic to penicillin, augmentin is probably a good substitute. Good for anthrax. probably not that common on a boat, but it's a very good broad spectrum antibiotic. So cefalexin is the one they've chosen as the general one for your cat toos, and that's a good, it treats chest, it treats skin infections, and so a lot of those things are very common on a boat. And augmentin is actually a very good antibiotic, only twice a day, and it's just, you can't have it if people have got penicillin allergies, and that's why they've taken it off, just to make it easier for people. Doxycycline, if people are cruising, particularly going up cruising, or if you're going up north, you're going to the tropics, doxycycline is useful because it's used for a lot of the marine skin infections, coral cuts. The only downside is not everybody, it can cause some photosensitivity, which may or may not be good for the tropics. So we can, if you want, we can get them to send the talk round, so you don't need to worry about remembering anything. So the antifungal cream is quite good because, you know, we're sitting there in a hot, sweating environment. A lot of people get sort of even this minor stuff can get irritating and destroy your sort of holiday or your race if you don't treat it. So, for some reason, so this is all the gastrointestinal stuff. Obviously, you've got your antidiarrheals, and I think actually the one place you do not want to get, you know, diarrhea is nobody else wants you to get it either, is on a racing boat or on a cruise. And for some reason, your antacids are only there for your Cat 1 race, which I can't understand because they're very simple and a very common problem. You know, people get a bit of gastritis. So that I think it's always useful to have a pack of antacids on the boat. So, for many things, you know, prevention is better than cure. Some people sort of get on a boat and they think, oh, it's great, I can go to sort of like a boat grot, you know, for the next 4 or 5 days or a week, and hygiene goes out the window, they don't wash their hands, they don't change their clothes, you know. So prevention is better, and then they get sick for no good reason, obviously. So prevention is also better than cure, you know, hand sanitizers, washing your hands, but if you need, getting some ORS stuff on the boat is also good, so the oral rehydration things. I've got a little talk on sickness in this talk, so I might go past that and come back to it. So, in the, what I'd say is in the offshore racing rules, they have promethazine, you know, phenergan at 25 milligrams. That's enough to really sedate a horse. So, that comes in 10, I don't know why they've chosen that, goodness knows, but it comes in, also what else it says in the guidelines, it says or equivalent. So you can choose to take an equivalent and still be kosher if you're doing your, complying with the rules for an offshore race. So I would say to people, take 10 milligram tablets, take the packet of 10 milligrams rather than the 25 milligrams because it's much more useful. People can take it. I remember one person who was doing Sydney Hobart and said to me, oh look, I get terrible seasickness the first day and I've been taking 25 milligrams of promethazine 4 times a day, but I can't. And I was thinking, and they said, then I get really tired. Of course you get really tired. You know, so there are different things you can take. And you've got on the, for the race, you've also got adrenaline, obviously, for treating allergies. Although it's hoped if somebody knows they've got an allergy that they should also take their own EpiPen. So some of the other things you can consider, and this probably applies more if you, particularly if you're going up cruising, you know, things that you want to sort of treat or might happen are very common are, you know, the swimmer's ears. So taking something like the aqua ear, which is a combination of, aqua is a combination of alcohol and a vinegar like acetic acid. So it's really good for sort of just sterilising the ears. And then the antibiotics, so Sofradex are the antibiotic drops. One at the bottom, the Kenicomb, there's a lot of things to consider. These are all just very helpful things to have, particularly if you're being longer time on the boat. And Kenicomb is what I call the cream for the diagnostically challenged because it has a steroid, an antibiotic and an antifungal, so it doesn't matter what it is. It treats everything. So it's actually quite a helpful thing. If you don't know what it is, just give it to them. Okay, so, sorry it was a bit of a rush through, but got a few slides to go through. So we're going to talk a little bit about seasickness. couldn't resist. So, seasickness is derived from the Greek. And it's this horrible motion sickness. It's that sort of it's the disagreement between what you see, what your ears feel is happening with their, because your ears have got sort of your cochlea, and you've got sort of what your ears are feeling has happened, and what your proprioception, what your body is feeling, your feet and things are feeling has happened. And when these don't align up, which is common on a boat, that's when people get seasick. You know, it's that dysregulation. And you can make almost anyone motion sick if you put your mind to it. You know, there is a little bit of self-selection. Most people who get sick looking at a mill pond do not go sailing for very long. But you know, there is, if you put your mind to it, there's certain triggers, and most people can get seasick at some point if they put, or motion sick if they put their mind to it, or if they get enough of a particular stimulus. So we talked a little bit about this. This is what I was talking about with the difference between what you feel and what you're looking at. And that's why we often say, you know, if you get seasick, you get people to horizon fix, because at least you're fixing one point for them. So it's hopefully making some of it a bit better. And the other thing I would say with seasickness, we don't absolutely understand it. And that's why a lot of the treatments are quite broad spectrum suppressors of like neurotransmission, because we don't absolutely understand which receptor does it or exactly how it happens, but we know there's that incongruent, that a lot of the medication for it just dampens down those neurotransmitters. So, there's differences in susceptibility. I always find it interesting. They always say that children under 2 don't get seasick. I suppose some of them might, but I think it's because they're always wobbling around, falling over. So maybe that's just a normal part of the course. And certainly there is what people's expectations are. You know, if people are scared, if they're tired, cold, they're much more susceptible. And they did an experiment with sort of on naval cadets, because that's who you experiment on, where they lined up half of them and told them it's going to be, you know, a rough crossing, but they'll all be absolutely fine. You know, and lots of reassurance and lots of this is what we're doing. And then they had the other half where they told them it's going to be terrible and you're all going to be sick as dogs, etc., etc. And strange enough, all the ones they told that to got significantly more sick than the other people who all thought it was going to be great. And that's important, because if you've got somebody who is, you know, first time off and they're tired and they're wet and they're cold and they're vomiting, is providing, you know, support and reassurance is much more helpful than sort of, you know, beating them up about it. So there's conflicting, food is like, a lot of people talk about ginger and other things. There's not great evidence about it, and so I always say to people, works for you, take it. You know, if you've got some food that works better for you or some food that makes things worse, that's fine. There's not great evidence about it, so it's just empiric. You know, if it works for you, then that's absolutely fine. So we all know what is happening with seasickness, and it's not just the vomiting. I think people would say it's that horrible churning, you know, feeling. So it's not just the vomiting, which is why some of the standard anti-vomiting medicine is not as good for seasickness. And it's also fatigable, so they do say that at some point your body works this out. If you're persistently at sea, then usually by day 3, this should all settle down. But if you go off and go on land for a bit and then come back, and you are prone to seasickness, it can reoccur. So if you know that you've got somebody who's susceptible, you are susceptible to seasickness, or somebody you know is, or it's going to be horribly rough, I always say you need to preload like a teenager going to a party. It's so much better. If you take stuff before you leave the shore, that works so much better than if you wait till you get sick. One, because it's harder to keep it down if you're already vomiting, but it's much better, you know, if you take stuff that morning, if you take stuff the night before, and then you take it the morning, and you're much more likely to be effective than if you wait till you feel unwell. Yeah, talk about managing people. Yeah, and they work much better in advance than afterwards. So most of the ones that we're looking at when we look at what treats seasickness, most of them are like the old-fashioned antihistamines and things like benzodiazepines. But then there's also payback because obviously if people are taking a whole lot of diazepam, they're probably not going to function very well. But they might stop being seasick. There's lots of medications you can try, and some of them you start at the top with the ones that just buy the counter. And a lot of people who say they've got from the UK, you can't get here, swear by the scopolamine patches, which they've got from the UK. And then the other thing I'd say is ondansetron is a wafer which is good for, it's good because it's a wafer, it dissolves on the tongue, so it's very helpful if people are vomiting. But it will help with the vomiting, but it won't help with some of the horrible malaise, clammy, horrible feeling that other people get. But it may be enough that then they can take some of the medication to feel better. Amphetamines apparently work very well, but not in our offshore kits. And sometimes, you know, particularly if people have got glaucoma or other problems, you've got to be a bit careful. But most of the stuff here is over the counter, or you can get through your doctor. Oh yes. If you take away their cigarettes, it reduces their motion sickness. They may be absolutely unbearable, but they might not throw up. So it depends. It's a you know, it's a bit of a play off. Okay. I always like this one. Hopefully you have none of those when you go out sailing. So I was asked about this, many years ago I started giving these talks, I was asked about this, I was thinking, what are you talking about? I like the grotty, spotty, yachty, botty. So this is that sort of that combination between irritation and infection that a lot of people get when they're going out sailing, particularly perhaps if they're racing, particularly if they're getting hot and they're getting sweaty, that people get, they get this sort of nasty sort of skin infections. So they can get, it's sort of a combo between bacterial and fungal often, because you're getting that sort of lovely sort of wet, hot, sweaty environments that fungal infections like, and also you've probably got a bit of sort of skin infection as well. I hate to say this, but hygiene is your friend, people. But you can also obviously treat it. So a lot of the creams, like the chemicone cream, or the other creams I was talking about, will also treat it. So a combination antifungal, antibacterial will treat it. Joys of sailing in Perth. So, another time. Probably got another 15, and then we can have a stretch and a break. Talk a little bit about managing of injuries. So they can always, often common on boat. Fortunately, most of them are going to be quite minor. And if they're more than minor, then you probably want people to get off your boat and go somewhere else. So head injuries are quite common. People hit their head on booms, they hit their head on going down companionways. What counts as a minor head injury? So they're not vomiting, they're not knocked out, they're alert, they're orientated, they sort of go ouch and they're moving on. And they're not on anticoagulants like warfarin or, apixaban or any of those medicines. The next one is things like sprains. So it's often worth having, because you've got to, obviously boats move all the time, they're wobbly. A little bit of strapping tape is probably quite helpful on the boat. And just doing ankles, doing the knees are probably quite good. So most common fractures are often forearms, or people sort of go over and they, triple something unexpected. It's often your forearms. And sometimes if you're unlucky, if you're going down companionways and so on, you can do more serious, you can do ribs and so on. And generally wanting anything more than something simple, you're going to want advice. And if it's particularly it's a forearm, a lot of people are saying don't wear rings because they're, of injuries, getting caught on ropes or winches. But if they do wear a ring, you want to take it off pretty quickly, because if you have an injury, you're going to get swelling. And if you take it off quite quickly, you can probably get it off. If you wait for an hour or two and everything's got really swollen, it might be more tricky. So boaties, a lot of people carry either you can get these inflatable splints for those who are going off for longer, which are really easy. You can fit them around, arms, or you can fit around legs. And you get sand splints, which are sort of the moulding ones. You can mould to injuries. But a lot of people have used all sorts of bits of boat equipment for splinting a fracture, often quite inventively and quite successfully. So I find a lot of boaties are quite good at thinking, I think we can make that out of this. And jury rig's something that works. I might skip a little bit over some of this, but this is just really what can go wrong with fractures. That's a tendon for those that don't know those. So an open fracture is one that goes through your skin. Obviously that's going to be going out for some medical care, but these are ones you'd give antibiotics for if you had them, that you would put saline soap gauzes on, and obviously try to arrange for them to go off and go to have care. Probably come from that. Okay. Best done early rings, take them off early. You can actually use, if you've got anything coloring, you can use it off. You can actually get them off. Usually washing up liquid's quite good for getting off rings, or anything that's sort of greasy or oily to get off rings is pretty good. And this is a technique where you thread a thread under, and then you pull it up, and I've certainly had that work quite well. For sort of, these are rings that have been on, some put them on 30 years ago, and they haven't taken them off ever since then. The reason to elevate is because it reduces your swelling. If you get less swelling, you get less pain, which is always a good end point. We're going to talk a little bit about lacerations. The most important thing, often, if you have a wound on a boat, is to clean it. And the solution to pollution is dilution. I always say to people, if all you've got is water, you clean with water. If you've got, some sterile saline, you clean with that. It doesn't matter too much as long as you're not using what's ever in the bilge. As long as you clean it with something that's reasonably clean. So why do we, you go and see, everything heals eventually. So if you go and see, your doctor, if you've got a wound, you go to the emergency department, we close it because if you close it up, it heals. If you left it be, the vast majority of wounds will heal from the bottom up, and they'll heal themselves, and it will take longer, and you'll get a broader scar. So that's really why we close wounds. So you can do, if it's, if you're off and it's a complicated wound, or it's deep, or it's, in a place that's going to be tricky, you can just, do nothing. You're going to put, clean it, you're going to put a sort of a dressing on that's not going to stick to it, and it's going to get medical care whenever you get off the boat and you go to shore. But, if you're offshore for a while, or, there are simple things that your medic, a lot of people have nurses, doctors on the boat, or the medic, and they'll be very happy, like a simple small wound, to treat it. The other reason sometimes for treating things is if you've got lacerations on the scalp. The scalp has a really good blood supply, so it bleeds like stink. And then you've got people on aspirin or anticoagulants that bleed even more. So that's why on the Cap 1 kits, but I will show you today, is you've got the staplers, because the stapler's really good. It closes the scalp wound really quickly, and it stops it bleeding. Other than that, you're sitting there leaning on it forever, and it just doesn't stop. So there's various things that you'll know from it. And we've got some tissue glue, which we'll look at after the break. And tissue glue is like sterile super glue, expensive sterile super glue, because they colour it pink or purple, and then they put a more expensive price tag on it. But in essence, it's very similar. And that's very simple wounds that aren't under any tension. And then you can use steri-strips as well. You will find on a boat that steri-strips won't stick very well. So what I tend to do is glue the steri-strip down, and then pull it over, and then glue the steri-strip on the other side. And that actually works quite well as a combination for wounds which are under a little bit of tension, but not too much. And staple. And if you are going off for a while, particularly if you've got expertise, you may consider, like a lot of big boats will have suture material as well, if they've got people who can suture. Okay. So glue glue is relatively expensive for what it is, because each small tube costs $30. But I suppose in the combination of what's actually on the boat, it's probably a small drop in the ocean of what else is expensive on a boat. That's sort of what you do with glue. The only thing is, if you're gluing on that, you would always make sure the person's laid flat. You never sit them up to glue, because obviously glue can run a bit, and what you don't want it doing is running down into the eye. So you'd always lay them flat, and the same with the forehead, you'd lay them flat and glue it so it's going to run off that way, and it's not going to run down that way. So these are things we glue, really simple, and it provides a sort of a closure, stops any bacteria getting in as well. So it's a really good, easy thing. We talked a bit about steri-strips and gluing steri-strips. Fixamol is actually quite good if you don't have steri-strips, and for today I've just cut some little bits of Fixamol in, and you can use those as steri-strips as well. It's clean, not sterile, but for a lot of wounds that doesn't matter too much. So staplers are in the Cat 1 kit, they're not in the Cat 2. Doesn't mean you can't have them if you want to, but they're not, you don't have to for regulations. You don't really on the boat, they're really going to be for scalp wounds, and they're very good for scalp wounds. You don't have to shave the hair, you just clean it and then you just staple through. I know it pinches, it actually probably hurts less than putting local anaesthetic in. I usually say to people, if I'm putting 2 or 3 staples in, I say I can put local anaesthetic, but it will hurt just as much as putting the staples in. And that's what you do. You basically put them in, the wounds lined up and pulled together, and you basically put them in, there's a V on the machine, you put it in sort of every 1 centimetre or so. And that's what you can close, and that sort of thing. And that sort of thing, should you have that thing on your boat as well. Okay. Sutures really are only going to be on the boat if you've got people with expertise who are going to be doing it. But if you do, and they're going further, then it's reasonable to have it. So we're going to talk a little bit about iron injections, which we'll do a bit after the break. So I might just skip, in the interest of time, I'll just skip over that. Yep, and actually, ode for hygiene on a boat is always a good plan. So one thing you probably should at least have an idea in your head is, how do you manage when you have somebody who's seriously unwell on the boat? Whether it's a medical illness, you know, whether they've had a heart attack, or whether they've had a serious injury. Because, you know, this can be a spectrum between it happening on a lovely day where it's the middle of the day, nothing else is happening, the boat is going along light winds, and someone's unfortunately fallen down the companionway steps and hurt themselves. And so then, and then it can be different, it could be in the middle of the night, and you're going downwind, and you're sort of broached, and you've got the kite in the water, and the boat's like this. So generally you want to have a team boat and a team person approach. Now if you're in light airs, then actually probably most people can look after it, because the boat's sitting there, it's not going anywhere, it's not impeding your ability to look after that person. Whereas if you've got things where you actually need to look after the boat to look after the person, then you're going to have both to have team boat and team person. You don't all need to gravitate one way or the other. And you need to have clear communication. You know, I work a lot in resus, and one of the things is no one should ever have to raise their voice. We have emergencies in, we work as a team. You know, there's no shouting, there's clear communication. But you also close the loop so that, you know, if somebody says, you know, can you pass me this, or can you get the first aid kit, you'll go and say, I've got this, so somebody knows what you've done and where you've got to. So there's that closed loop communication. And your team leader in different roles. So you always might have, generally if say you've got your skipper on the boat, and they would usually take that role. But it doesn't mean that other people can't take that role. You know, if we do a recess and there's 3 consultants and I'm doing the airway and someone else is team leading, they're in that role and they do that job, and I would do the airway role. Even though I could do the other roles, you're still in that role and you do it, so you do your role. And also communication, whether it's the verbal communication. If you've got a big crew, somebody should be sort of on the comms, and they're sitting there both on the comms sending information either on your radio or on your satellite phone, but also writing everything down, because you want to keep a log. It's very hard afterwards. You know, when we do a recess, one of our staff is actually there with a clipboard writing down everything that's happened, so that afterwards you can go, and when did we give that, and what happened then? Because you might think you remember, but after the time you can't remember your time frames, and it can be, for serious incidents, very important. And you should have an idea or have a practice session, even if you just do a paper practice session of, what will you do, who would pick roles, who would go where, because your most important thing on your boat are your people, and we look after our boats, but we look after our boats to look after our people as well. So this is the link for this, and I've got some of these. So a lot of people say, well, how do I get hold of these medications? Now, for the offshore races, this is a link for supply to pharmacists. So pharmacists, but most of these prescription medications. Now, there's 2 ways around that. Obviously, for people who have a GP, you can go and a good relation with your GP, you can go and talk to your GP, and you may say, look, I'm going to do this, or we're going cruising, we're going racing, can you give me a script for these things? And you show them what you need, and they, most your GPs, if you've got a good relationship with them and you're not dodgy, they probably will be helpful. There is the other way you can do it as a skipper, and a lot of the commercial boats do this under the regulations. There's regulations for pharmacists to be able to supply ships and to also supply racing boats under these regulations without a script from a doctor. So you go with this, and you go with the copy of your special regulations, what you need, and your pharmacist will fill out the form, and they can supply them to you directly. On this form, it does say the race, the racing yachts, the race must depart from WA. There are 3 such races, and here it does say Fremantle to Albany, Fremantle to Bali, and to Geraldton. I don't think that's an issue because obviously the Fremantle Exmouth has replaced the Fremantle to Bali race, but that's the link there. Okay. I think that takes us up. So happy to take any questions. I'm going to be around if you want to come up and ask any questions as well, or we can have a stretch and break.
Sorry.
Yeah.
I ask a question. So if I'm going to a pharmacist, is that only for if you're racing boats, or does that also apply for cruisers? Can we just go with the list to the pharmacist?
No. You have to be to get the medication without a script from the doctor. It has to be under an authorised race, or commercial vessels can do it under the regulations as well. But for cruising, I think your best if you're cruising is to see your local GP. But I'd probably take a copy of the regulations with you and say, look, this is what's advised. We're going off doing something similar. Is it possible to have a script for this? Yeah.
I think Kenny was telling us about green whistles.
Yes. Yeah.
How do we get those? They sound good.
For personal use?
Absolutely not.
No. No. So the green whistles. I mean, this is.
Little donkeys.
Oh, okay.
We're not pronounced.
Green whistles are good. What have we got?
Break time.
You've got to tell people that you're going on late.
very good.
Not too punchy.
But he did say they